Hi, this is Eyton Shalom, and I'm back with my patient Elizabeth, treating her premenstrual phase discomfort of swollen, tender breasts, melancholia, I'm calling it, and a little bit of irritability, and also bloating. And the bloating continues through the bleeding part of the cycle, and she describes the bloating as being in possibly her stomach and her intestines, but it doesn't sound like uterine cramps per se, more what we would call chi stagnation bloating. And it's not a bloating that's resolved through passing gas. Okay, so starting point, I am going to do a regulating point for the gut. It's the front so-called moo point or alarm point for the stomach, but that includes, well, it's the stomach. And I just want to feel here, is that tender there?
A little bit.
Yeah, how about here?
A little bit.
A little bit, yeah, okay. And then below the belly button. So the good thing is below the belly, how's that feel?
Fine.
Yeah, below the belly button feels 100% normal, and that's really good because below the belly button, you want it to feel strong and tight in a good way, not tense tight, but firm. That relates to what we call the kidney chi. She's a young person, she's healthy, she's an athlete, she eats well, she should have good kidney chi, and in fact she does. And then okay over there as well, but where even now it's like about a week before your period, like it's hard to percuss with the gloves on, but it's a little bit hollow sounding, not that bad. Do you feel bloated right now?
Yes.
Yeah, you do, right? Because I can feel that.
Yeah.
So like when I press down, I could feel some bubbles.
Yeah.
So your transverse colon of your large intestine crosses over right here, whereas your stomach's more up there. So that could certainly be. Do you have any trouble passing gas?
No.
Oh, okay, all right, okay. But this is what everything you've described is not relieved by passing gas.
Right.
Yeah, it's not the same thing. How about right there?
That seems fine.
Yeah, okay. The last place I want to palpate is underneath your rib cage here. Now, if I were a Japanese acupuncturist, I would have massaged your abdomen first, but I'm not. And I did massage it a little bit. Is that tender in there?
A little bit. I heard some bubbles
Yeah.
just then.
So here's the rib cage. When it's tight right underneath the rib cage there, that's a clear-cut symptom of what we call liver depression chi stagnation, which is just a fancy term for the way that stress gets to you in terms of creating tension in the gut. You know, the fight aspect of the nervous system, fight or flight or fight, flight, freeze, the predictable locations where the tension of life gets us, where when I say the tension of life, where we feel what we call stress. Like when people just say, I feel stressed out, they're never talking about fear. They're never talking about anxiety. They're talking about being irritable. They're talking about wanting it all to go away, right? So, and that's the fight aspect of the nervous system, which is the same part of your nervous system that you recruit if you actually do need to fight. Predictable places where that gets us: one, the jaw. People clench their jaw. Two, the shoulders. Three, and between the shoulder blades. But four, around the diaphragm and the muscles along the back where the thoracic vertebra end and the lumbar vertebra begin. That's called the thoracolumbar junction. That's a really key area in a human being, just energetically. And I don't mean woo-woo energy. I mean what you learn if you massage people with your hands for a living. That's like a junction between the upper body and the beginning of the lower body. And it just so happens that the thoracolumbar junction, where T12 ends and L1 begins, is also where your diaphragm is. And guess what? Your diaphragm is a giant muscle. And your lungs can't work unless the diaphragm works. The lungs have no ability, they're just bellows. they have no ability to take in the air on their own. It's only because when you breathe, your that's why there's this thing called diaphragmatic breathing, which is really a Western term for pranayama, what we do in yoga. When the diaphragm expands, that pulls air into the lungs. When the diaphragm goes back the other way, the air goes out. A lot of people with anxiety and perfectionism have shallow breathing. And it's sort of an observation that I've made, and my yoga teacher used to say this as well, that women tend to be more shallow breathers than men. He attributed it to the fact that men let themselves overeat really easily, better than women. And so like we're just in our bellies like animals. And that's what he attributed to. And it might be something to that. But I have noticed shallow breathing amongst female patients more than amongst male patients. And so that can be, so about the places where we feel tension, the fight aspect in the jaw, neck, and shoulders, and also the rib cage. But then fear and anxiety tends to get us much more in the belly and in the low back. And that's why, you know, when we even say in English, like, I was so scared, I was, pardon my French, I was so scared I was shitting my pants. I was so scared I was pissing in my pants. Chinese medicine describes that fear makes the chi rush downward, like sudden fear. You know, like you're suddenly being chased by a monster in your nightmare and you're a little kid and you wet your bed. So fear and anxiety can affect us in the belly. But when you feel this real hard to get your fingers in underneath the rib cage here, especially on the left side more than the right, but both sides, that always tells us liver qi. And if I were giving her an herb formula, I might give her Shao Chai Hu Tong, which is a cardinal formula for releasing liver qi that's affecting the gut. The other thing is that I palpate is this between the ribs. Oh, that didn't work. Well, it doesn't matter. I'm right there in the ribs there. That is the front mu point or alarm point for the liver qi. And is that tender?
A
little, yeah, when I pressed a little harder right there, yeah. So that's always tells us liver qi. And what's interesting is on the left side, the liver is on the right side, the physical liver is on the right side. Why is this point tell me that there's liver qi? Because the channel, the internal acupuncture channel goes from the liver across to the left side. And that's why we have these two patterns of gut issues, one called liver invading spleen, another called gallbladder invading the stomach. And they follow that pathway. There's also a pathway from the liver up to the side of the head via the gallbladder. That's very involved with tension headaches. And then finally, the reason why the liver qi is so important with menstruation, and not only menstruation, chronic prostate issues in men, bladder issues, is because
sorry.
That's okay. The liver channel also goes down through the lower body and then down through the leg to the end of the big toe. So now, enough speaking. So now I'm going to do this front alarm point or mu point of the liver for the liver qi. And I'm putting this one in a horizontal insertion because I never want to puncture a lung, obviously. So that's the safe way to do this point is so I'm pulling, I don't know if you can, I'm pulling the skin away, like I'm pinching her. I'm pulling the skin away from the body so I can put the needle in parallel to the body rather than into the body, because that's not safe to do it that way there. If I were doing massage, I could go into that. And then, so now, which is more tender, here more or here more? If you have to think about it, I'm going to do this one.
Okay.
And I'm going to do this one quite gently because this point can be quite strong, and even a pro like Elizabeth. You're okay. That was okay. Yeah. Sometimes people, so just to clarify something, if I compare your abdomen to a patient with really bad PMS and really bad menstrual cycle stuff and really bad gut issues, because again, the bad thing about you as an example to use here is all of your symptoms are quite mild. I can barely get a needle in that point with those, and so that's why I was being so careful with you. And then I will also just do the front alarm points for the large intestine. And there we go. How many minutes are we? Okay, good, 10 minutes, great. And then same point on this side. So I measure 2 inches lateral from the belly button in the high point of the muscle. Now, one more thing, because of this whole gas issue, we have what are called ancestral vessels. I won't get into it now, but they're channels that are not related to the organs per se. They're conceived that they were formed in the embryonic phase. And so this is one of them, and we use these, it's on the gallbladder channel. These are points on what's called the dye channel, the belt channel. And the belt channel, I like to use it a lot in menstrual issues when I can see that there's like a constriction this way. And so then you do the points on the belt channel, and then the middle of the body kind of opens up, relaxes. That's how I learned that, and I like it. So then the command point, as it were, of that vessel, there's one on the foot and one that matches it on this hand, right there. Okay, and then, let me bring this with me. There's a really lovely point on the, oh, look out. Oh man, well, that's why I'm glad I bought this cover. I was waiting for that to happen. That's happened before. These are not made for being moved around. Let me put that back in. All right. Let's see. We're almost done.